All right. So now we want to go on to PMF therapy for high blood pressure. Many people have been calling me over the last few weeks wanting to know the therapy for blood pressure, how to use it, how is this going to help with blood pressure. And so what are the causes of high blood pressure? The exact cause of high blood pressure not clear, but several things can increase your risk, including number one, stress. Lifestyle and daily stress from the job, home, daily challenges create vasoconstriction. It means your arteries constrict. It's kind of like stepping on a water hose out in the yard. You're gonna not allow the water to flow through. So the same thing with constriction, as they constrict, that can increase your blood pressure because the heart has to pump harder, and then it has to bring the blood back into the bottom of the heart to, as far as circulation. You got systolic, diastolic, and systolic. Also, age. The risk of high blood pressure increases with age. Elder people are more likely to develop high blood pressure. Obesity is another issue. The more you weigh, the more blood you need to supply oxygen to the different organs and nutrients to your tissues. Plaque buildup from certain food groups can also contribute to high blood pressure. Smoking. Smoking will immediately raise your blood pressure temporarily, but the chemicals in tobacco can damage your artery walls as far as arteriosclerosis. Too much salt, table salt. Now, you've got Himalayan salt. It can be good for you, but like regular old table salt has shown that the growth of processed food industry has affected the amount of salt in diets worldwide, and this plays an important role in high blood pressure. Drinking too much alcohol. Heavy drinking can damage your artery walls and your heart also. How does PEMF therapy work for high blood pressure? PEMF is a safe, effective, and non-invasive method of reducing your blood pressure. It speaks the language that your body is able to understand. As we all know, our cells communicate through bioelectric currents, just like the lower frequency waves distributed from a PEMF device. Poor circulation is the root cause of high blood pressure. Improving circulation is one of the most essential mechanisms of the healing effects of PEMF therapy. In a healthy cellular environment, blood vessels produce nitric oxide continually. In other words, diminished production of nitric oxide adversely affects the blood flow and other vascular functions. PEMF therapy can re-energize your damaged cells by inducing electrical charges within the cells to restore them to their healthy state. Then the inner lining of the blood vessels uses nitric oxide to signal the proximal smooth muscles in the blood vessels wall to relax. So it helps the blood vessels to relax. And then the blood vessels widen. The subsequent increase in blood flow leads to a decrease in both blood pressure and also your heart rate. Now, these are therapy protocols for high blood pressure. So PEMF therapy will affect your body in many ways, and we will use many programs and frequencies to achieve the best circulatory result. It is best to use the magnet with the ring off to treat the largest area possible. From Russian research, we know that 9.2 is the cardio frequency, so that we want to use that as much as possible at 100% in the center of the torso. Also, we use the recover mode for several hours and at night in the sleep cycle if you can sleep with the recover mode going. We also want to use the 7.8 hertz and 10 hertz as much as possible. Now, we suggest adding the angstrom supplements Relax for vasodilation and magnesium or calcium magnesium to your daily regimen. These minerals increase the effectiveness of PEMF in your cells and tissue. I've got several customers that order the Relax religiously. They've taken medications, they've been to therapy, they've done all kinds of dieted, and they take the Relax product, also the magnesium, and of course the CalMag is good because the calcium is part of cellular optimization, and then magnesium in CalMag, it pulls the calcium into your bones, it also into the tissue and into the cells. So those are three choices: Relax, magnesium, or CalMag, calcium magnesium.